Anatomy. Pointing index, benediction hand, and date thumb deformity is due to involvement of median nerve. Carpal tunnel syndrome is due to compression of median nerve. Wrist drop is due to involvement of radial nerve. Saturday night palsy and crutch palsy are due to compression of radial nerve. Cubital tunnel syndrome and Guyon tunnel syndrome is due to compression of ulnar nerve. Froment's book test, card/paper test, and Degoa test are to check the integrity of ulnar nerve. Pen test is to check the integrity of median nerve. Winging of scapula is due to injury to long thoracic nerve or nerve of Bell. Regimental badge sensory loss is due to involvement of axillary nerve. Boxer's muscle is serratus anterior. Climber's muscle is latissimus dorsi. Drop shoulder is due to paralysis of trapezius. Policeman tip deformity, waiter's tip or porter's tip, is due to ERBS paralysis, injury to upper trunk of brachial plexus. Klump's paralysis is due to injury to lower trunk of brachial plexus and presence with Claw-Handan-Horner's syndrome. Laborer's nerve is median nerve. Musician nerve is ulnar nerve. Anterior interosseous nerve is a branch of median nerve. Posterior interosseous nerve is a branch of radial nerve. Ulnar nerve passes behind the medial epicondyle. Root value of ulnar nerve is C7, C8 and T1. Adductor, pollicis, is supplied by ulnar nerve. Subscapular artery is a branch of third part of axillary artery. Supination and pronation occurs at radio-ulnar joint. Bigelow ligament, iliofemoral ligament, is strongest ligament of body. Content of femoral canal is lymph node of Rosenmuller/Glocase LN. Tibial or medial collateral ligament is degenerated tendon of adductor magnus. Fibular or lateral collateral ligament is degenerated tendon of peroneus longus. Trendelenburg sign and lurching gait is due to superior gluteal nerve injury. Tarsal tunnel syndrome is due to compression of tibial nerve. Foot drop is due to involvement of common peroneal nerve. Skin of first web space on dorsum of foot is supplied by deep peroneal nerve. Inversion and diversion movement is at subtalar joint. Inversion is by tibialis, anterior and posterior. Eversion is by peroneus, longus and brevis. Unlocking of knee joint is by popliteus. Locking of knee joint is by quadriceps. Anteroposterior stability of knee joint is maintained by cruciate ligaments, anterior and posterior. Pes anserinus or guy ropes includes sartorius, gracilis, semitendinosus. Soleus is the peripheral heart of body. Femoral artery begins at the mid-inguinal point, midway between the ascus and pubic symphysis. Gluteus medius and minimus are supplied by the superior gluteal nerve. Root value of sciatic nerve is L4, L5, S1, S2, S3. Root value of pudendal nerve is S2, S3, S4. First costosternal joint is primary cartilaginous joint. Bronchopulmonary segment 10 in right lung and 10 in left lung and pulmonary vein is intersegmental. For pleural tap, needle is inserted along upper border of rib. Structures passing through aortic opening of diaphragm are aorta, thoracic duct and dasygus vein. Coronary sinus is located at posterior part of atrioventricular groove/coronary sulcus. Anterior cardiac vein drains directly in the right atrium. Right coronary artery takes origin from right/anterior aortic sinus. Anterior interventricular artery/left anterior descending artery is a branch of left coronary artery. Posterior interventricular artery is a branch of right coronary artery. Cardiac dominance is according to origin of posterior interventricular artery. Boundaries of triangle of Coquard tendon of Tadaro, above, base of septal leaflet of tricuspid valve, below, and orifice of coronary, sinus, base/anterior. Fossa ovalis, crista terminalis and torus aorticus are found in right atrium. Papillary muscle and chorda tendinei are found in right and left ventricle. Structure which arches over hilum of right lung is azygous vein. Structure which arches over hilum of left lung is arch of aorta. Poupar's ligament is inguinal ligament. Watershed area, Griffith point is at splenic flexure, between superior mesenteric artery and inferior mesenteric artery. Watershed area, Sudex point is at recto-sigmoid junction, between inferior mesenteric artery and internal iliac artery. Valve of Eccrine/plica circulars are found in small intestine, mainly in jejunum. Dermatome of umbilicus is T10. Nerve of cremasteric reflex is genitofemoral nerve. Superficial inguinal ring is a deficiency in the external oblique aponeurosis. Deep inguinal ring is a deficiency in the transversalis fascia. Left gastric artery is the direct branch of celiac trunk. Superior pancreatico-duodenal artery is a branch of gastroduodenal artery. Gonadal artery, ovarian/testicular artery, is a branch of abdominal aorta. Left testicular vein and left suprarenal vein drains into left renal vein. Normal angle of anteflexion of uterus is 125 degrees. Contents of lieno-renal ligament are tail of pancreas and splenic artery. Portal vein is formed by the union of the splenic and superior mesenteric veins. Houston's valve is found in rectum. Duct of Wirsung is main pancreatic duct. Brunner's gland is found in duodenum. Peyer's patch is found in ileum. Red pulp and white pulp and pals is found in spleen. Space of Dease is found in liver. Duct of Bellini and Malpighian corpuscle is found in kidney. Hassel's corpuscles is found in thymus. Arnold's nerve / Alderman nerve is auricular branch of vagus nerve. Vidian nerve is nerve to pterygoid canal. Jacobson nerve is tympanic branch of glossopharyngeal nerve. Lymph node of tonsil is jugulodigastric lymph node. Lymph node of tongue is jugulo-omohyoid lymph node. Posterior cricoarytenoid is abductor of the vocal cord. Abducent nerve and internal carotid artery are the direct contents of the cavernous sinus. Structures related to the lateral wall of cavernous sinus are oculomotor nerve, trochlear nerve, ophthalmic nerve and maxillary nerve, from above downwards. Cricothyroid is supplied by external laryngeal nerve. Sensory supply of larynx below vocal cord is recurrent laryngeal nerve. Skin around the angle of mandible is supplied by greater auricular nerve. Lateral pterygoid helps in depression of mandible. Safety muscle of tongue is genioglossus. Taste sensations from anterior 2/3 of tongue is carried by chorda tympani. Vertebral artery is a branch of third part of subclavian artery. Nasolacrimal duct opens in the inferior meatus of lateral wall of nasal cavity. Muscles of mastication, temporalis, masseter, medial and lateral pterygoid, are supplied by mandibular nerve. Superior labial artery is a branch of facial artery. Largest / thickest cranial nerve is trigeminal nerve. Most slender / thinnest cranial nerve is trochlear nerve. Cranial nerve with longest intracranial course is trochlear nerve. Cranial nerve with longest extracranial course is vagus nerve. Cranial nerve with longest interosseous course is facial nerve. Only cranial nerve which emerge on dorsal aspect of brainstem is trochlear nerve. Cranial nerve which is most commonly involved in increased intracranial pressure is abducent nerve. Cranial nerve which is most commonly involved in intracranial aneurysm is oculomotor nerve. Pure sensory cranial nerves are 1, 2, 8. Pure motor cranial nerves are 3, 4, 6, 11, 12. Mixed cranial nerves are 5, 7, 9, 10. Cranial nerves carrying parasympathetic fibers are 3, 7, 9, 10. First branch of facial nerve / branch from geniculate ganglion is greater petrosal nerve. Optic radiation is related to lateral geniculate body and auditory radiation is related to medial geniculate body. Arcuate fasciculus connects motor / Broca's and sensory / Wernicke's speech areas. Corpus callosum is an example of commissural fibers. Visual area of cortex is supplied by posterior cerebral artery. Subarachnoid space NZS2. Lateral spinothalamic tract is concerned with pain and temperature. Anterior spinothalamic tract is concerned with crude touch and pressure. Dorsal column is concerned with fine touch, vibration and conscious proprioception. Rubrospinal tract is a extrapyramidal tract. Haploid number of chromosomes is seen in secondary spermatocyte. Implantation occurs at 6 to 7 days at the stage of blastocyst. Derivatives of ventral mesogastrium are lesser omentum, falciform ligament, coronary ligament and triangular ligament. Derivatives of dorsal mesogastrium are greater omentum, gastrosplenic ligament, gastrophrenic ligament and lienorenal ligament. Diaphragm is formed by septum transversum, pleuroperitoneal membrane. Median umbilical ligament, uricus, is remnant of allantois. Medial umbilical ligament is remnant of distal part of umbilical artery, proximal part of umbilical artery persists as superior vesical artery. Ligamentum hepatis teres is remnant of umbilical vein. Remnant of notochord is nucleus pulposus of intervertebral disc. Remnants of mesonephric / Wolffian duct are Gartner's duct, epiphoron and periphoron. Remnants of paramesonephric / Mullerian duct are appendix of testis and prostatic utricle. Arch of aorta develops from left fourth aortic arch. Common carotid artery develops from third aortic arch, both sides. Stapedial and hiatal arteries develops from second aortic arch, both sides. Maxillary artery develops from first aortic arch, both sides. Superior vena cava develops from right anterior cardinal vein and right common cardinal vein. Trigone of bladder is formed by absorption of mesonephric duct, mesodermal in nature. Cerebellum develops from rhombencephalon. Closure of cranial / anterior neuropore occurs at 25th day IUL, defect in its closure leads to anencephaly. Closure of caudal / posterior neuropore occurs at 28th day IUL, defect in its closure leads to spina bifida. Closure of neural tube begins at the cervical region. Lower vagina develops from sinovaginal bulbs of urogenital sinus. Anal canal below pectinate line is formed by proctodeum / anal pit, ectodermal in nature. Epiblast forms primitive streak, notochord and all 3 germ layers. Vertebrae and dribs develop from paraxial mesoderm. Gastrulation, formation of 3 germ layers, occurs at 3 weeks of gestation. Placenta develops from the decidua basalis and chorion frondosum. Parafollicular cells of thyroid develop from the neural crest cells ultimobranchial body. Genital swellings in male differentiate into scrotum and in female differentiate into labia majora. Topics must be covered for AIIMS. 1. Brain anatomy equals Brodmann areas Broca Wernicke, arterial supply. 2. Fornix hippocampus mammillary body regions. 3. Anterior chest wall and intercostal muscles. 4. Phrenic nerve. 5. Venous drainage of chest wall. 6. Diaphragm opening and structures passing through it. 7. Cleft lip and cleft palate. 8. Genital ridge swelling fold tubercle and their male-female derivatives. 9. Epithelial lining histology. 10. Choanod liver segments and liver anatomy. 11. Muscles forming walls of pelvis. 12. Larynx muscles anatomy. 13. Contents of femoral sheath. 14. Auriculotemporal nerve and great auricular nerve. 15. Lateral pterygoid temporalis muscles and their functions. 16. Base of skull, related foramens and structures passing through it. 17. Eccrine, apocrine, holocrine glands an example. 18. Book test card test Froment Sinegawa test. 19. A thumb.pen test pointing index. 20. Thumb and finger drop wrist drop. 21. Lumbricals and interossei muscles. 22. Different tissues and types of collagen. 23. Pharyngeal pouches and arch derivatives. 24. Brachial plexus. 25. Anatomy of heart. Subscribe the channel for more update.